Good morning. This is patient Mrs. Margarita Torrence, patient of Dr. Patwardhan's office. Just going to ask you a couple questions regarding Dr. Pat, the treatment that he's given you, basically if you would refer him, the issues that he's going through. I know you know a little bit about. Basically, just so everybody out there could see that he does everything from the kindness of his heart, not for money. He puts patients' health first. And let's go ahead and start. So what is your medical problem?
Primary problem is I'm diabetic.
Okay.
And I've just been within the last month diagnosed with myasthenia gravis.
Okay. What is myasthenia gravis?
It's an autoimmune disease.
Mm-hmm.
They explained it to me the simplest way is that your nerves don't talk to the muscles. There's a breakdown there. There are symptoms that are kind of generic, so it's kind of hard to just all of a sudden look at somebody and say, oh yeah, this is what it is.
Mm-hmm.
But the worst of it was that I couldn't hold my head up.
Okay.
Speech slurs, a lot of stroke-like symptoms,
Mm-hmm.
but it's affected my eyes. I have double vision.
Okay.
And generally annoying.
Okay. Okay. Now, before Dr. Pat, have you ever approached any other doctor?
I had a doctor that I had since about 1967,
Okay.
and he delivered my kids. I had been going to him for years, and eventually I went to work for him. I worked with him for 22 years.
Wow. Okay, so that was, besides Dr. Pat, that was the only one?
Well, aside from the
specialist.
The specialist for,
Okay. Mm-hmm.
arthritis and all that kind of stuff.
Okay. Now, how did you find Dr. Pat?
Well, he was my mother's doctor, and to tell you the truth, I'm not sure, I can't remember how we wound up here. I want to say that maybe her doctor at the time was out of town, and maybe Dr. Pat took the calls. I don't know.
Mm-hmm.
But I took care of my parents, my in-laws, and excuse me, an elderly aunt.
Mm-hmm.
And so I would come to the appointments, and I liked them.
Okay.
I liked what I saw.
Okay. Now, you said your mother, or you were telling me your mother had cancer. What type of cancer did she have?
She had pancreatic cancer.
Okay. And do you know about how many years was she Dr. Pat's patient?
Well, between 5 and 10 years.
Okay. Okay. Now, how long have you been Dr. Pat's patient?
Somewhere between 15 to 20 years. Probably closer to 15.
Okay. And how are you able to pay for the treatment that Dr. Pat provides?
Well, up until this incident
Mm-hmm.
happened, I have insurance. I have a PPO. We have paid more money for the PPO because I won't say who I go to.
Okay.
And so the insurance covered it. Since I turned 65 in January, Medicare is now my primary, and my understanding is that Medicare will not pay him.
Okay.
And which, Medicare is not going to pay him, the PPO is not going to pay him either.
Mm-hmm.
I made a choice, and don't tell him.
Mm-hmm.
I pay him. I give him some money. I just don't feel right. I can do that. I have the money to do that at
Mm-hmm.
this time. At some point, I may not.
Mm-hmm.
But I just feel that he deserves to get money for what he does.
Okay. Now, if you don't see Dr. Pat, what other choices do you have for treatment as a primary?
I have to start looking because I've been away from the working in the doctor's office for probably 5, 6 years now, so I've kind of lost track of doctors.
Okay.
I have to go hunting.
Okay. Now, you were also telling me, like, from experience, the way that Dr. Pat treats you. He keeps in touch with your other doctors.
Yes, he does.
He does. And he basically stays updated to what your health is right
Yes.
now. Okay. Now, another thing, what do you think about the problem that's going on with Dr. Pat? Would you still refer him? Do you think that maybe it was ethical or unethical of his side to do what he did? I don't know. What input do you have?
Well, you know, rules have exceptions,
Mhm.
and if he did what he did because he wanted to make more money, I wouldn't have approved. But
Mhm.
that's not what he did. He did it because he was helping his patients,
Mhm.
and that was his primary purpose.
Okay.
Um, he needs to get paid for what he does. I mean, it's not, him not getting paid is not only hurting him,
Mhm.
it's hurting his employees, it's hurting his patients.
Mhm.
I'm sure that those patients who can't pay him and whose insurance will not pay him
Mhm.
probably have to go somewhere else.
Mhm.
They may not be getting the best treatment somewhere else.
Mhm.
And from experience, I know that I can come in here, Dr. Pat's going to listen to what I tell him.
Mhm.
And I can't recall him ever telling me no when I ask him, can we try this?
Mhm.
I mean, he certainly won't do anything that's going to harm me.
Yeah.
But, you know, if it's reasonable and he says, okay, let's give it a try.
Mhm. Okay. Now, so would you recommend him?
Absolutely. I have, having worked in the doctor's office, because the doctor that I worked for was just part-time, so he didn't have hospital admitting privileges anymore. Some of the patients that we had there that needed that type of a doctor who could do that, I referred them. I trust Dr. Pat.
Mhm. Yeah, of course, he was your mother's doctor. There was a lot of trust there. Okay, now, is there anything else you would like to add, maybe, so people out there can see that that he is a good doctor, or anything you would like to add?
Well, I think if you sit and if you've had other doctors and you sit and compare the two,
Mhm.
I think Dr. Pat's going to come up on top every time, because of various problems that I've had through my life, and I've seen a lot of other doctors, specialists,
Mhm.
and they, you know, rush you in, listen to you for a couple minutes, and then rush out.
Mhm.
And you know, Dr. Pat always comes in, sits down, and we go over
Mhm.
what's going on. You know, what do you think? What do you need? And when my mother was ill, because she decided to not take the treatment for her cancer,
Mhm.
he did give me his cell phone number in case I needed him on the weekends or at night.
Mhm.
And I've never had anybody else, any other doctor do that.
Mhm.
You call the doctor on call,
Mhm.
or you get the answering service.
Mhm.
He has introduced me to his staff as he's gotten new girls,
Mhm.
and he's told them that, you know, I'm his friend,
Mhm.
which I don't feel I've been any other doctor's friend. So that in itself is unique.
Mhm. Sounds good. Well, thank you so much, Miss Margie, for the interview you just gave us. I know that if you ever need anything, the Dr. Pat and his staff will be here for you. If you have any questions, you know, you can just go ahead and come to me or come to any of the other staff members. My name's Janet, and thank you again.